Hello, this is Dr. Tejaswi, and I work as general physician. Today, I want to convey you some information on constipation. Constipation is a condition in which a person usually passes less than three stools a week, or whenever he passes hard, lumpy stools, painful to defecate, etc. There is nothing like normal number of times the person can pass his stools, but usually we consider as three stools, at least three stools per week, or the stools which are not harder to pass is a condition which is prescribed to be normal. Most common cause of constipation is eating food which is very, very less in fiber. We need to take at least 35 grams of fiber per day in our diet. And not keeping ourselves hydrated, taking less amount of water can also lead to constipation. Physical inactivity or stress, these are also the upcoming causes of constipation we see nowadays. Sudden change in our routine, that is traveling to a place which is different from our routine, or activities which are different from our routine, usually causes constipation. Taking large amount of milk and cheese is also one of the cause for constipation. Sometimes a person usually resists his urge to pass his bowel. That is also one of the cause for constipation. If a person says that he can't pass his stools at least three times a week, or whenever he passes his stool, he usually have hard, lumpy stools, very painful to defecate, or he need to press his abdomen or insert his finger to evacuate his bowel. If there is any incomplete evacuation, feeling of incomplete evacuation following his passage of stool, these are all some of the signs of constipation, which patient usually conveys us in the form of symptoms. He usually strains when he passes his stool. A case of constipation can be diagnosed through his signs. Later, we usually advise few tests, most commonly being thyroid profile in the first place, thyroid profile and serum calcium levels. If at all they appear to be normal, then we advise X-ray erect abdomen, defecography, MRA defecography, sigmoidoscopy, colonoscopy, balloon expulsion test, anorectal manometry. These are all different types of diagnostic tests available for us to evaluate the cause of constipation. Only if all his regular diet pattern is normal. That is, he's taking good amount of fiber, he's taking good amount of fluids, his physical activity is good, there is no stress in the activities he's performing, there is no resistance from himself in passing stools. All this usually rushes towards these diagnostic tests to evaluate his intestines if there are any sluggish bowel movements, or if there is any physiological problem in his intestine. To evaluate such things, we usually prefer these diagnostic tests. We advise to drink more amount of fluids, at least 3 to 4 liters per day. And whatever food he takes, we advise him to take fiber content not less than 35 grams per day. Fiber diets are usually two types, both insoluble and soluble fibers. These help them to form a bulk of stool, also activate the motility throughout the intestine. So they usually pass stools at least once a day. Coffee is expected to mobilize the gut 60% greater than water, but at the same time, more of coffee is usually hazardous. So we advise at least coffee at least once a day. Probiotics. Probiotics are something which promotes the growth of healthy bacteria in our intestine. These bacteria are usually useful for us to maintain normal motility patterns. So, if due to any reason these bacteria, healthy bacteria, are less in our intestine, intake of probiotics can help us and relieve the problem of chronic constipation. Along with this, prebiotics can also be helpful. And some other things, inclusions in our diet, like plenty of vegetables, more of fruits, banana, prunes, dry fruits, all this help us to relieve patients' constipation. And if at all, despite taking all these food items, you feel your constipation problem is not rectified, you can avoid milk and cheesy products also. Most of the overlooking cases of constipation occur in childhood. When the parents could not make full attention to the bowel habits of children, they usually experience the chronic complications like intestinal obstruction, fecal impaction, then rectocele, hemorrhoids, bowel incontinence, fissures, and these all leading to anemia.